What can be done to smooth out the bags under my eyes? I'm wondering what can be done to smooth out the bags under my eyes and what is the cost. I heard of a procedure where they use a little needle and just drain it.
Thank you for your question. You submitted 2 photos and you're asking about a procedure to help smooth out eye bags. And you also mentioned your question about a procedure that involves a needle that drains the eye bags. So I think you definitely need to get some information and to understand what these eye bags are. I'm a cosmetic oculofacial plastic surgeon. That means my background training is in eye surgery as well as cosmetic surgery, and eyelid surgery and eye bag surgery is something I do pretty much every day. And to help you understand what these bags are, because I think by the way you ask the question, you think this is fluid. So when puffiness under the eyes is constant, and it only fluctuates a little bit, but it's always puffy. Well, this puffiness is actually fat instead of fluid. And fat is tissue. And when we refer to this fat, when it causes the eyes to look baggy, we call it lower eyelid fat prolapse. That means the fat that is behind the eye, that normally surrounds the eye, pushes forward and becomes a hernia, pushes forward and out. The reason why a lot of people do confuse this naturally with fluid is that certainly allergies and sinus problems, eye rubbing can all cause the eyes to look puffy and be related to fluid. When you have both the bags and allergies, your eyes can look very puffy. In your situation, in our practice, we would typically address your problem first by physical examination and confirming the puffy bags as being fat, and perform a procedure such as a transconjunctival lower eyelid blepharoplasty. This is a procedure which is performed from the inside of the eyelid to actually address the fat pockets. That means resection or removal as well as repositioning as is appropriate. In addition, we employ the use of platelet-rich plasma, which is derived from your own blood and helps improve the quality of the skin by generating collagen and blood supply and improving the healthiness of the skin, because the eyelid skin is the thinnest skin in the body, and improving this quality is very beneficial. Sometimes we also do fractional CO2 laser to help the external skin structure and to reduce the fine lines and wrinkles. So at this point, I think that you should meet with qualified, experienced cosmetic surgeons and learn about the options. The things that we can't do from just a photo is a physical exam. It's very important to understand the function and the support structures of the eye before undergoing lower eyelid surgery. As a specialist, I deal with complications of lower eyelid surgery every week, and people come to us from all over the world for resolution. And so performing a physical exam such as a snap test and seeing how well the support is critically important. I always say that lower eyelid surgery is deceptively oversimplified by many doctors, and unfortunately that results in undesirable results such as the eyelid being pulled down or everted. So meet with qualified, experienced cosmetic surgeons, and once you get comfortable, move forward. I think it'll make a significant difference for you. I hope that was helpful. I wish you the best of luck, and thank you for your question.